three announcements. First, there are two sign-up sheets over there for CEUs. One is for social workers, counselors, nurses, and a variety of nurses and that sort of thing. The other is for Athens, Nami, the National Alliance on Mental Illness, the local chapter of Nami, and the Friends of the Library. It's co-sponsored, and we want to thank the Friends of the Library and especially Todd Bastine, the illustrious gentleman standing by the door, who helps us with this. And since we have a captive audience here of marvelous people, I think I should say a few words about Nami. We've been discussing in our board meeting the fact that we really do need to reach out, and because we have a lot of services that I think would be useful, we think would be useful for the public in general. It's a family organization of people who have adult loved ones with mental illness, children with mental illness, and some people who themselves have mental illnesses. And we offer, almost always, but this year we didn't get enough people, a family-to-family course, which is for those people who have adult loved ones that have a mental illness. It's free, takes place in the evening, for how many weeks?
We hold it for 11 weeks.
For 11 weeks. And that's a good one. My wife and I took it several times, and I imagine that if you have a loved one who has a mental illness and you're just coming to this for the first time, you're just experiencing the shock of finding that out, and you really want to help that person, you feel really alone and really in need of support and information. And that's precisely what NAMI does. We give you that support and that information in the family-to-family class. We also have, but have had trouble getting enough people to make the course meet. We have courses for persons with, specifically for persons with children with mental illness, and we have a course that's taught by and it's for persons who themselves are in recovery from mental illness. The other thing that's really important about NAMI is that we have a support group meeting. It's confidential. It happens twice a month, the first and third Thursdays of the month, and it's a place where if you're just experiencing the shock of having to try to figure out how to help a loved one, or even if it's been a while and you still need support, everyone in that meeting is experiencing the same sort of thing, and you can actually get, it's very good for your morale, and also a bunch of ideas that may be very helpful for you. And that takes place, as I said, in 6:30 to 7 p.m. in Appalachian Behavioral Health Care, which is the name for the mental hospital, on the first and third Thursdays. So please reach out to us. Mental illness is very common. 1 in 5 people have it, or will have it, and so in all likelihood, a lot of people here might have some family member or might themselves have need some support. Now let me say a few words about tonight's event. This is the second evening we have devoted to perinatal, or what used to be called postpartum disorders. But since sometimes as many as 20%, the different estimates of all moms are affected by this disorder, the subject really cries out for more attention. Tonight we have two great people who have agreed to talk with us. Our main speaker, Leslie Paulette-Stoyer, of Summit County Maternal Depression Network, is going to be giving a longer talk. She's going to be talking about her personal experience with maternal depression and her subsequent work to help other moms afflicted by it. Following Leslie, the appropriately named Pam Bourne who is in charge of all things. Where's Pam? She's in charge of all things. She's sort of the guru of all things related to birthing and early motherhood here in Athens at Ablenis Hospital, and she'll give us a brief overview of what's available for local moms. So we have the experiential information and what one mom is doing to try to help other moms, and then we have what can be done and what is being done here in Athens. After that, we should have time for plenty of Q&A. I've never seen one of these meetings that there isn't a lot of Q&A, so don't be timid. So please help me welcome Leslie and Pam.
Thank you for attending. I'm going to start off, like Tom said, with my story on perinatal depression. When I talk about perinatal depression, I'm going to most likely, because it's up here in my head, I'm going to be referring to it as postpartum depression. But know that any of these symptoms can come on prior to birth, during the time when you're pregnant, and subsequent thereto. So that we're talking that time frame, even if I use the word postpartum depression. And I'm sorry because I moved on you, but so this is my story. That's how I'm going to start. Just a little bit of background about myself. I graduated from college in 1986, decided that I was going to go on to law school, and graduated from law school in 1989. Pretty driven person, pretty career-oriented, knew where I wanted to go, was pretty regimented in what my background plans were. Again, I'm just giving you a little bit of personality about who I am and where I'm going with this. And you'll see how that all comes into the big picture a little bit later on. So my little cartoons up there, went to school, graduated, started climbing the corporate ladder. Got married in 1992 to my wonderful husband, we've been married now for 22 years. My daughter's in the audience, and she's smiling. Her dad, and he's a wonderful guy. We were married for about 4.5 years before we had my baby girl, who's sitting in the audience. So there she is. There's our birth announcement. I was working the whole time I was pregnant. I was an attorney. I was a corporate litigator. Again, pretty driven, pretty intense career, pretty high pressure career, and I like to think that I functioned in it pretty well. I practiced for 7 years before I had her. Now, during this whole period of time, by the way, that's her right after she was born. During this whole period of time that I was practicing law, again, pretty driven, and my husband came home from work one day and he said, you know what, I'm really not happy in my job. I want to start looking around. I said, okay, fine. We were living in northern New Jersey at the time. That's where I practiced law. And he came home and one day and he said, I have a job interview. My job interview's in central Pennsylvania. And I said, okay, well, we have family in Pennsylvania. It's where I grew up. I grew up in eastern Pennsylvania. And so he took the interview, we talked about it, and we decided, okay, this is what we're going to do. So right after this little one was born, 8 weeks later, after a very long and very trying house closing that we had, we moved from New Jersey to Pennsylvania. And there I am in July 1996 holding my newborn baby girl. And during this time, because I was switching from being a corporate litigator to a stay-at-home mom. I decided, you know what, I'm going to take some time. I'm licensed to practice in Pennsylvania, but I want to stay home with my daughter. I want to be a stay-at-home mom. We'll do that for a while and see how that goes. Things were going pretty well, and then my husband started doing a lot of traveling. I should add that this little one was very, very colicky when she was born. She was probably colicky until about 4.5, 5 months. She cried incessantly. If she was awake, she was crying. Turns out, we found out much later on that she had a milk allergy. I was nursing her. I didn't know she had a milk allergy, but that's where all of this colic, we're presuming, came from. So let's just make sure I have my notes and all that stuff. So I had some difficulty nursing. I think every mom has that. Then once things started to get settled when we were in Pennsylvania, my husband started traveling for this new job. We didn't know he was going to have to travel, but he started traveling. So this picture that you see in May 1997 was shortly after he came home from being a month away from being gone an entire month. He came home for a weekend for his sister's wedding, and he went right back to South Carolina, where he was working at the time. So you know that song by Harry Chapin, Cats in the Cradle, he learned to walk while I was away. Well, that was my daughter. She learned to walk while he was away, and I was the sole primary caretaker because I'm in a rural Pennsylvania. Didn't really have any new friends. There were no moms groups around that I knew about. I had family, but they were all working. They were all away during the day, and felt very alone and very isolated. Back in this next picture, May 1997, we're all dressed up because we were going to my sister-in-law's wedding. My husband left that Monday, and my world came crashing down. I had stopped nursing my daughter in April, and about 2 weeks later, which was when, shortly after that picture was taken, postpartum depression just knocked me to my knees. I became so fatigued, so distraught. I could not sleep. I went for about 72 hours without sleep, and when I tell you I went 72 hours without sleep, not a drop of sleep did I have. I was fatigued, couldn't get up off the couch to get a jar of baby food out of the cabinet, couldn't walk down to the mailbox, just rocked my world. I think you probably saw from this picture here too, now granted I was thinner back then, but I was unable to keep weight on, and in hindsight, shortly after she was born, I was one of those women that was able to drop that baby weight immediately. In hindsight, I'm thinking I probably was a little symptomatic of postpartum depression, but just didn't realize it. I had stopped eating. I had stopped sleeping. I was anxiety-ridden, and like I said, my world came crashing down, and I was knocked to my knees. My husband was away. My parents came to stay with me for several days. I went to go see a doctor. Now remember, I had just relocated, so I didn't have my primary care physician around. I didn't have any local medical people because we had only been there several months. Took my daughter to the pediatrician regularly, but I didn't go to the doctor regularly. So I went to the first guy that I pulled out of the phone book, and he was the closest guy I could get to in this little small rural town I was living in. And I said, is it possible that I could have postpartum depression? I just weaned my daughter. It came on so suddenly after all of this. And he said, no, you can't have postpartum depression. Your daughter's 9 months old. And he put me on antihistamines, muscle relaxers, and back then Ambien had just come on the market. Well, I think you probably all know what Ambien is. It's a sleeping medication. And he gave me a prescription for Ambien because, like I said, I was not sleeping. So I took this medication, I took it to the pharmacist, And I gave it to the pharmacist. He's like, oh, Ambien. He said, this is some powerful stuff he put you on. And I said, well, I sure hope so because I haven't been sleeping. And he said, let me tell you this. He said, if this doesn't help you sleep, you have a real problem. So you don't tell that to an anxiety-ridden woman who hasn't slept in 3 days. Because I went home and I took an Ambien, and guess what? It did nothing. Absolutely nothing. Could not sleep. I muddled through that period of time. Seeing that same physician, I would go back. I would tell him the same symptoms all over again. And he continued to prescribe those medications that I just told you about. And I tried to get better. I got a little bit of my strength back. I started trying to exercise. It was difficult because I was so fatigued. I wasn't sleeping well. But I started moving on for my life. And this went on for about 3 months until I got, now remember, this is before the internet. So I get this magazine in the mail. It's dated August 1997. So by that time, my daughter was 13 months old. And I'd been struggling with this since she was about 9 months. In the article, in the magazine was an article on postpartum depression. And I read the article, and I could have written every word of it myself. Every word. That woman that wrote the article had a very high-powered job as an IT coordinator. She left her job when her child was an infant to travel from England, where they lived, to New Jersey to live. She felt isolated. She had no friends. She had left her job. Her husband had started a new job. All those same things that I had done. I literally could have written it and substituted our names in. And at the end of the article were references to where people could get help for postpartum depression. And I thought, my goodness, this doctor that I've been seeing for the last 4 months knows nothing about what I'm going through. I need to get help. So I called those references, and I found this lady. Her name's Karen Kleeman. She had just written This Isn't What I Expected. At the time, it was the book on postpartum depression. She wrote it with her sister-in-law, who happens to be a psychiatrist in Chicago. So her sister-in-law wrote the medical aspect of it. Karen was a licensed social worker who had started the Postpartum Stress Center in Philadelphia, Pennsylvania. So therein started my 2-year journey to and from Philadelphia once a week to go see Karen for an hour, and then periodically to go see a psychiatrist for an hour. Karen sat with me on the phone when I called her. She sat with me on the phone for an hour, and she said, you have postpartum depression. We need to get you down here, and we need to get you well. She set up an appointment with herself for the following week. She set up an appointment with the psychiatrist that she worked hand in hand with. I went to see the psychiatrist as soon as I got down there, and she said, I don't know why he has you on this medication. Get off that stuff and let me put you on something that's going to work. She started me on Zoloft, and within about 3 months, because antidepressants, I don't know how familiar you are with them, but take about 6 to 8 weeks to reach their kick-in point, and so about 6 to 8 weeks later, I was feeling back to myself. And continued to see Karen and my psychiatrist for, like I said, a couple of years. That's my story. I'll finish up with it in a little bit, and I'm going to tie some of those things in here as we go through some statistics. As Tom said, approximately 10 to 15% of people, and these vary depending on what publication you read, but this particular statistic came out of the World Health Organization that wrote a paper that is a conglomerate of all the published research, and it's all been peer-reviewed, et cetera. So these are the statistics I'm going to use for you guys right now. But postpartum depression, 10 to 15% of the people. Baby blues, up to 75% of women who give birth get the baby blues. Psychosis, postpartum psychosis, I think we've all heard that in the news because it gets so sensationalized. People hear the word postpartum depression and they think she's going to kill her baby, she's going to kill herself, something's going on. Postpartum psychosis, you can see those from 0.1 to 0.2% are the stats on people who are diagnosed with postpartum psychosis. Very, very rare. You'll also see the onset on here, which I think is very, very telling. Baby blues, 3 to 4 days, usually lasts hours to a couple of weeks. And treatment, it basically some family support, somebody to pitch in, take care of that baby until you can get over the hump with the baby blues. Postpartum depression comes weeks or takes weeks or months to recover from. In my case, it was obviously prolonged because I got poor help the first time around. Probably would have been, if we put everything in perspective, about 2 months or so till those meds started kicking in, until my therapy that I was going for weekly also relieved me of some of those feelings, angst, depression, anxiety that I was feeling with related to becoming a new mother, taking a leave of absence from my job, my husband's new job, and in essence losing my identity because I felt like I'd lost my identity. Treatment is usually required, and I would say, not usually, I would say if you have postpartum depression or feeling the symptoms that we're going to get into, you need to seek some medical treatment. Psychosis usually comes about within 2 weeks after the birth of the baby. Again, weeks or months in duration. Hospitalization is required generally for that. And if you suspect anybody that you know or love of postpartum psychosis, they need to be in the hospital and they need to get help immediately. So going through the signs of, or the symptoms of baby blues, get some mood swings, anxiety, sadness, and I'm not belittling any of these emotions, feelings, but again, you have to put it all in perspective of the duration. Does it last 3 days? Is it lasting more than 2 weeks? If it's lasting more than 2 weeks, something may be spilling over into that postpartum depression. Crying, decreased concentration, trouble sleeping. And then we get into postpartum depression. Again, very similar to the baby blues, but check out the list of symptoms there. Loss of appetite, who had that? That was me. Insomnia, who had that? That was me. I was very irritable. You can attribute that to not sleeping, not eating well, whatever, but definitely had that. Overwhelming fatigue. I described that all to you as well. Loss of interest in sex. Well, my husband wasn't home, but I can tell you that I had no interest at that point anyway. Lack of joy in life, the feeling of that. Feelings of shame, guilt, and inadequacy. I have to tell you, I felt every one of those because here I was this privileged mom. I didn't have to work. I was living in a beautiful home. I had a beautiful child. Why was I feeling any of this? Because I shouldn't have been. I had everything at my feet. Difficulty bonding with the baby. That didn't really occur for me because my postpartum had happened by 9 months or so. I was very fortunate that I had a strong bond, but I can tell you it was very difficult to take care of her because of how fatigued I was feeling. Withdrawal from family and friends, definitely had that. The only people that knew that I had, that I was having these issues were my husband, my parents, and my best friend. That was it. No one else. I wasn't telling anybody. There's a stigma behind it. There's sort of an anxiety that goes along with it too, that if anybody finds out I'm feeling this, they're going to take my baby away. They're not going to think I'm a good mom. I'm probably not a good mom right now, but nobody's going to be taking her away from me. Then we get into postpartum psychosis. Again, I want to just emphasize how extremely rare this is, but there are symptoms of confusion, disorientation, hallucinations and delusions. This all goes with the terminology psychosis, paranoia, and attempts to harm yourself or your baby. And again, if anybody is feeling that they need to be hospitalized and medicated immediately. Just went through all of these with you, but I want to focus on the last one, which I did not mention, because I just wanted to get into it a little bit. Thoughts of harming yourself or your baby. This was the scariest thing that happened to me during this entire period. It probably fed into my lack of ability to sleep, my lack of ability to eat. Karen, when I finally went to go see Karen, asked me if I was having these, and I almost said no because I didn't want anybody to know. But what she explained to me and what I read in her book were, these are scary thoughts. They're scary, repetitive thoughts that repeat in your head. So what are some of these thoughts? What if I drop my baby when I get down the steps? What if I burn the baby in the bathtub? I'm afraid to take one of my knives out of the kitchen dishwasher because what if it slips and hurts the baby? I could picture myself driving off the road with myself and my baby in the car. I think my family would be better off without me. I'm having sexual thoughts about my baby. Did not have that one, but I can tell you all the others I did. I can see terrible, graphic, violent things happening to my baby. That one I did not have either. However, these are just examples of those thoughts that go along. And what Karen assured me was, I didn't have postpartum psychosis. I wasn't listening to somebody else telling me to do something to my child. These were just fears and anxiety, intense anxiety, repetitively going through my mind. It reassured me that what I was going through as somebody who was dealing with postpartum depression, that those were normal symptoms of postpartum depression, and no one was going to take my child away from me because of it. And, again, while not normal thoughts that you would have, they were normal when it came to postpartum depression. Very reassuring, because they were very, very scary thoughts to have. Now we get into some risk factors. Had somebody told me this, I took those baby classes when I was pregnant. My husband went along with me. I think they spent all of about 5 minutes on baby blues, postpartum depression, but definitely it was mentioned, and definitely if you're feeling any of these symptoms and they gave you a list of symptoms, you should go see your doctor. Of course, that was probably 15 months prior to when I actually experienced my postpartum depression. So it was not in the forefront of my mind. But history of depression, either during pregnancy or at other times. I did not have depression during pregnancy. In fact, I was one of the happiest pregnant people that you will ever meet. But I can tell you this, when I was in college, I did have an eating disorder. I was treated for the eating disorder. I suffered from both anorexia and bulimia, and was treated for both of those, and thought I had overcome all of that. But again, when you think about it, that goes back to a mental health issue. So I did have that. Another thing that's not listed on here is something that Karen told me about, which is that driven personality, that perfectionist type personality. While I would never categorize myself as a type A person, I definitely had some of those perfectionist tendencies, had to do everything perfect, wanted to make sure everything was done perfect, everything had to be put in its place, and I definitely have that as a component of my personality, clearly. I had never been pregnant before, so obviously I did not have postpartum depression, but you'll see in a little bit that if you have postpartum depression with one baby, it's a 50-50 chance you're going to have it with the next one, statistically speaking. You've experienced stressful events. Well, I don't need to repeat any of them. I told you all my story, so all of those stressful things that factored into my move, the birth of my daughter, etc., all factored into those. Having problems with a relationship with your spouse or significant other. This is a really significant symptom. I personally did not have this. My husband was very supportive of me. In fact, he took over at one point because I was so fatigued. As soon as he would come over home from work, he took over the care of our daughter. He did bath time, he did bedtime, he did the reading goodnight. At that point, we had switched her over to a bottle. He bottle fed her, and he was very supportive. But weak support system, and that goes back into the lack of perception of people around you, a social network, friends, etc. And I did not have that, as I explained to you before. Financial problems, as I said to you before, we did not have that. Pregnancy was unplanned and unwanted. Did not have that, actually. She was very planned and very wanted, and still is. So one thing that I found interesting when I was doing putting some stats together for you all is that postpartum psychosis, the percentage is higher for women who have bipolar disorder. I did not know that until I was doing some of this, so I thought I'd add that in there as well. Again, like I just said, once you've had PPD, you have a 50-50 chance of getting it again. So what do? So about 2 years later, I had recovered. I found a mom's group where I was. I started to form some friends. My daughter had friends. And I was starting to come into my own with staying at home. It took me a really long time to transition from being a working woman, dual income, person to stay-at-home mom. But I did it. It took me a little longer than probably most people, but I did it. So we started talking about having a second baby. At this point, I was still seeing Karen, but not as frequently. And so as we were talking about it, one of the first things I did was call up Karen and say, what do I do? And she said, why don't you come down and let's have a session on it. So we did, and we worked out a birth plan. I wasn't even pregnant yet, but this is what we were going to do. We were going to make sure that everybody was on board to give me some support, that my parents were going to be around for a couple of weeks after the baby was born, that my husband was going to take some time off from work because he had literally gone right back to work. She was born on a Friday. He was back at work on a Monday. He was going to take some time off of work. I talked to the doctor. One thing that I didn't add is I had a really long and difficult labor with her and a difficult birth. Ended up 21 hours of labor, 3.5 hours of pushing until they finally did a forceps birth with her, and I had a 4th degree episiotomy, and it took me weeks and weeks and weeks to heal from it. I was in a lot of pain. So one thing I did was I had this new OBGYN. I said, listen, I don't want an episiotomy. If you're going to do an episiotomy on me, I want a C-section. Just telling you that right now. He knew my whole history. So again, just prepping people about where we're going. This is what I'm going to need. Setting limits. The other thing that I decided to do too was when the new baby came, I was not going to nurse. Nursing fell all on me, and this new baby was going to be bottle fed. And so about 3.5 years later, Frederick Curtis Stoyer III was born. And Curtis was born, had a very easy delivery with Curtis. He was an easy baby. But more so, I had this whole plan set in place. I was very fortunate I did not have postpartum depression after his birth. But I have to tell you this, is 6 weeks after he was born, my husband came home and he said, guess what? We're moving to Ohio. And all I could think of was, I gotta call Karen. So I did. I called Karen and I started getting back into therapy, and we made a plan. I set up my medical people out here way ahead of time. I had doctors for myself, I had doctors for my kids, I had schools planned out, and everything was planned for this move. The other thing that I did as soon as I got out here is I found a mother's group. And within a few short weeks after relocating to Ohio, I had a whole network of women who were right there and able to support me. So didn't happen again. Very fortunate. And so here we are later, my beautiful daughter sitting in the audience. And this was her in May of last year for her senior prom when she graduated from high school. And there's my son. And so that is my story. I hope you all learned a little bit something from what I said, but I'm going to let Pam fill in because I think you guys have some fabulous resources down here. But the other thing that I should get back to is I never did go back to practicing law. I met Ann and Tom at a Nami event in Columbus several years back because I'm a member of Nami Summit County up in Summit County in Akron, and actually started volunteering with them about 11 years ago. And about 4 years ago, myself and my co-director took over as executive directors there, the first paid positions that Nami Summit County had ever had. Still, we are the only paid positions that Nami Summit County has. But just changed the whole trajectory of my life. Had gone from practicing law and all of that, but took those skills that I learned and incorporated that into mental health and have become a real advocate for people with mental illness. And recovery is possible and in fact has happened because I'm living proof of it. So thank you all.
My name is Pam Bourne, and I'm the practice manager for Ohio Health Oblenus, Athens Medical Associates Obstetrics and Gynecology. It's a long name. We were formerly known as River Rose, if anybody of you are familiar with River Rose. We have quite a large practice. I'll tell you a little bit about the practice. We have 8 providers. We see about 26,000 patients a year, and we deliver about 500 babies, a little bit more. So it's a busy practice. But it's a group of people that really enjoy what we do. We enjoy our patients. We try to make our office a respectful environment, somewhere that our patients feel like they're part of our family and feel comfortable with telling us things. That's our hope. I'm really proud to be here in Athens. I think we've done a lot to incorporate mental health in with medical care. I think we have a long way to go, but I think that there's things that are happening that are really good. And the thing that I was asked by Tom to speak with you about today is what we are doing in our practice to identify women who might be at risk of developing postpartum depression or experience perinatal depression or even the psychoses as she was speaking of. As Leslie said, a little bit about our community. You know, we have a lot of alternative families in our community, and we have a lot of drug addiction in our community, and I'm not sure if you guys know how bad the drug addiction is. As I told Tom and Ann, I think they were a little surprised that 12 to 17% of the moms that we care for now are opiate addicted. So it's a large percentage of our population, unfortunately. And with that also comes trauma. A lot of those people have experienced trauma in their life. If I look at the background of some of these women and some of the things that they've experienced in their lives, I say to myself, well, I would maybe want to shoot up if I had to go through what some of these things these women have gone through. So identifying trauma is a huge part of what we're learning about. We're learning, my group right now, we're in training with, I'm not sure if anybody's familiar with Joe Bianco. He's with Ohio University, and with Don Graham. They're working with our group. We have monthly sessions to learn about trauma, about identifying trauma in our patients, about identifying trauma in ourselves, how some of the things that we hear from our patients affect us, and how to better manage those things. I think that's the biggest part, is identifying people that have gone through bad experiences and recognizing that for someone who's been sexually abused, labor and the exams that we put them through may be very traumatic to them, and how can we best support them in those things. So that's one aspect of what we're doing. Another aspect of what we're doing is we have started doing we've been doing the Edinburgh test for our women who, in the very first part of their pregnancy, we give them the Edinburgh screening tool. We have a nurse who reviews it, and we can identify in the very beginning if we have people that are already in the situations where they're depressed or they have situations of anxiety. So we can start working with them at the beginning of the pregnancy and maybe give them some medication that is okay for them to take while they're pregnant. And there are some medications that, while it's not the best for them to be on medications, but when we look at the alternative, we have to weigh the pros and cons of them being on medication or not being on medication. Later in the pregnancy, they're given a brochure, a little thing that talks about postpartum depression. And I know, as you said, that's sometimes not enough to give people something to read. And one of the things that we're working on a curriculum for our patients, things that we're going to educate them about, and I'm going to build in a little bit more into our curriculum about depression. But it is an easy to read little pamphlet that they can read about. But we also are performing postpartum screenings. We're doing the Edinburgh again at their 6 and 12-week visit. Unfortunately, a lot of our moms aren't coming in for their postpartum visit. You know, when you're weighing transportation issues and whether you're going to take your child to their doctor or whether you're going to go to your appointment, sometimes they make the choice of going to the pediatrician and not coming to their appointment. So we're kind of working closely now with the pediatric office. As I was telling Leslie and I were talking prior to this, the American Academy of Pediatrics is now suggesting that pediatricians give Edinburgh tools to women who bring their children in at 1 month, 2 months, and 4 months. Now, in Leslie's case...
You keep using the word Edinburgh. Can you explain?
I'm sorry, Edinburgh screening tool. I'm just talking like everybody knows what that is. It's just a brief survey that asks women about their feelings prior to the pregnancy, about their feelings after the pregnancy. The tool's a little bit different, but it basically talks about, I feel sad, 50% of the time, and then they mark a score, or I feel stressed out when this thing happens, and they mark the tool, and then we have a scoring that goes along with that, and it helps us identify. We hope they feel comfortable enough filling it out truthfully that we can help them. Sorry.
Thank you. That's good.
So where was I?
4 months.
I'm sorry.
4 months. So we were talking about pediatricians. So it's becoming widely recognized that a lot of times women are giving up that postpartum appointment and going to the pediatrician. So the American Academy of Pediatrics is suggesting that they provide this tool in the pediatric office. But as Leslie said, even at those increments in time, she didn't reach her breaking point until approximately 6 months.
It was about 9 months.
9 months,
actually.
9 months out. And so I think it's a lot of training everybody that has contact with that patient, whether it's the primary care physician, whether it's the pediatrician, whether it's the OB-GYN provider, to recognize these symptoms and offer the woman help. Here in Athens, the University Medical Associates Pediatric Group is giving the Edinburgh screening tool to women when they come in for their appointments with their children. But I do think that we could do more. In our area, we have a lot of women that lack support. Whether you're an international student that has moved here and you don't have family, that they're scared to death. They have no one to support them. And hopefully we've developed a relationship with them that we can kind of be a little bit of their family or recognize that there's a problem and help them get some help through the community at the university. We have women, like I said, the opiate addicted women that are transient housed. They live from couch to couch and don't really have a support network. We have a grant through the state that we're helping work with them and trying to make their lives a little bit easier. And then the LGBT community, we do have alternative families here, and a lot of times they are predisposed to postpartum depression. Just because they sometimes lack family support because of their lifestyle, their families disassociated themselves from them, or just the the stigma that they have from the community. So they need extra support, and we really need to work with them on identifying problems. And speaking to the LGBT community, I have some staff that have gone to SAFE training through the university to be more supportive and to, again, identify ahead of time things that might be uncomfortable for them and things that we can do to help better support them. So while everything is not perfect, I think that we're coming a long way, and just having things like Nami's presenting here to put this out to the public, and so people are aware of things that they can identify in their own families and their own women that are in their lives, and know that there is help out there. I forgot to mention one of the things that brought me to talking about postpartum depression, and I think back to one of my doctors had a woman in her office, and the woman was just completely, she was crying, we weren't really sure if she was going to be a harm to herself or a harm to her baby. And Leslie and I were talking, you know, a lot of times doctors don't want to ask these questions because then they're going to have to deal with what they're being told. And so my doctor had talked to her about depression, and the girl broke down and she was crying and she was just completely despondent. And my doctor walked out and she said, "What am I going to do? What am I going to do? I've opened up this can of worms." And it was like late in the day, and usually we would send the person to Tri-County Mental Health, which is now I got to remember their name, Hopewell. They weren't going to be available, and we just didn't know what to do with her. So we helped her to the emergency room, and we thought, this is not okay. This is not okay, because we want to ask these questions and we want to know these things, but we got to know what to do when we have this. So I spoke with Fran Wims, who is one of the professors at the psychology department at the university. And I said, do you ever have students that need to do a practicum, grad students that need to do a practicum? So she has started placing a graduate student in our office who's there every Tuesday and Thursday as we see pregnant women. And when we identify women we're trying to catch it beforehand, when we identify them with problems, we have this guy right here or this gal right here that can come in and talk to you. No stigma attached. You're here in the OB-GYN office. You know, you got some you know, you're feeling sad, you're feeling stressed. We've got someone that can come in and talk to you. And he can do a brief intervention, and they can come back later and have their longer appointment with him. He's under the direction of a licensed psychologist. And we're finding that having him embedded in our practice has really helped. It's helped my doctors understand more about how to manage things, how to identify things, but he's also really helped the women that come to our practice. So that's my hope for the future. My hope for the future is that when you go to your doctor's office, there is also somebody embedded in that office that can deal with mental health issues, that can help you not only with your stress, with anything that's happening, whether it's you have time management problems, whether you've got problems remembering to take your meds, that person can help. And that's my hope for the future. I'm seeing it happening. I see it happening in other places. I see it, it's happening in Tennessee. It's a big push in Tennessee. And I'm hoping it happens in Ohio, because we have to have those things go hand in hand.
Medication if needed, or counseling. What are some of the things that you're seeing that would be very helpful?
I would say to go back to what I did before my second pregnancy, which was different from what I did before my first pregnancy. My expectations were very different with my second pregnancy, given what I had gone through after the birth, my first birth. So I would make sure that there is a support system in place for people that are planning. Now, not everybody has a planned pregnancy, so not everybody can do it in advance, but certainly of 9 months before that baby's born, or 10 months, whatever the true gestation period is. But it certainly, you can line up your support systems in advance that way. Look for mothers groups. I know you said there's not a support network as far as postpartum, but I know there are a lot of different national. There's the Moms Club that I used to belong to back in Pennsylvania. We have another just local mothers group up in the Akron area. They're all over the place. So I would be surprised if there wasn't something specific in this county, and usually they advertise in the free local newspapers. But if you know, now in the age of technology, you can just Google. Moms Club, like I said, is a national organization, and you can, if you just Google them, they'll tell you where all they're located, where all their chapters are. I would say that was key, and then making sure that you have good family support around you for that pregnancy. You know, if you are a real type A perfectionist type personality, you're going to have really high expectations of yourself. I remember when I was pregnant and I was, you know, you're registering for your baby shower. I didn't even register for bottles because I was like, I'm nursing, I'm not going to need a bottle. Well, you know, it's just, it goes without saying that, you know, at times, I pumped, you know, at times I needed to, you know, bottle feed, or somebody else needed to bottle feed her. So I guess just making sure you lower those expectations down, make sure people are taking really good care of themselves, exercising, eating well, that type of thing. Do you have time?
If is from an organization called Poem, Perinatal Outreach, and what is it? Something or other to moms. And they actually have, they can partner the woman up with somebody who's been there, somebody who can be sort of their coach. So that's a good one. That one you get in touch with through, what is it, Mental Health America? That's the name of it. It's a Nami-like organization up in Columbus. But you look it up in the, just Google it, Poem, P-O-E-M, and you'll get it. Especially if you put postnatal in there or something.
And Liz, maybe this is something that we can bring up at the Children and Family Health Services Consortium that we have. I speak all the time about how fortunate we are here in Athens, that this community identifies a problem, and typically there's people that can step in and everybody gets together and says, how are we going to meet the challenge of this problem? And that's something that I think maybe we should bring up.
Yes.
Hope you don't think I'm sounding silly, but is it possible that adoptive parents, mothers, could have postpartum depression?
Absolutely.
Yeah, and anybody that's lost a child can also experience it. But definitely somebody that's adopted a child, if they don't have good support, if they, you know, didn't realize how stressful things were going to be, if they've got a baby that's colicky.
It's a complete lifestyle change, and then and depending on where you've adopted from, also whether or not that child has health problems, whether or not you're going through the social services system to adopt, or you're going through international adoption to adopt, that's all very stressful. You know, those of us who can have biological children can get pregnant and have biological children, but a lot of times people who are adopting are going through the stress of the adoption, the stress of infertility. So yeah, absolutely, they can go through all of that, and it goes back to those same issues too, as you know, whether or not you feel adequate as a mother. Certainly, they could have the same circumstances I did, where they're leaving their job and they're becoming a stay-at-home mom. All those things factor into it. So absolutely, they could have. It's just not that hormonal and chemical change that goes along with it. I do think that's a factor, and I do think that predisposed me to postpartum depression. But I think it was all of those circumstances that we talked about as well.
And piggybacking onto that a little bit, I was explaining to them that there is a small incidence of men also experiencing postpartum depression. Typically in a household where the woman is experiencing it, he's under stress, he's seeing that she's stressed, he's doing more with the baby, worrying about socioeconomic things that are happening. Men can also experience, they don't typically call it postpartum depression, but they can develop a depression too, related to the new baby coming home and the stress.
What if they're not from your practice? And what I hear is things like, my baby doesn't like me. And I've heard that a number of times, and it's so sad.
they can talk to their pediatrician. If they're from my practice, absolutely,
Yeah,
please
but
have them call.
We've been at all.
But you know, Hopewell is available.
Like I should bring it up if I have these.
Absolutely,
Talk about
yes, please do. There isn't a true support group in Athens, unfortunately, other than the Birth Circle is a nice organization of supportive women, supportive mothers, and they're a good resource for women. But just have them talk with their OBGYN physician. Liz in the back, she works with Holzer and works with their OBGYN group. Now she's a lactation consultant, but I know they have things in place as well. Both practices here in Athens have things in place to help those women. So really encourage them to contact their OB office. And we'll see what we can do to help.
And as far as support group is concerned, they've actually got some online support groups now as well. I know that the Postpartum Support International is a website. You can look it up, and I'll talk a little bit more about that in a minute because we're offering a training up in Summit County for that. But they have an online support group too, because so if you go on their website, certainly that's not the only thing that you want to be able to offer a woman, especially if they need meds, if they need therapy, but there are some online support groups too if there isn't anything local. My dream for my particular county, for every county quite frankly, would to be stress network like Karen has in place in Philadelphia and in South Jersey. She's expanded now to South Jersey. But there's an entire network of doctors, social workers. They also have support group meetings held right at the facility, and all of it is a focus on that perinatal period. So that would be my hope.
You mentor them? Would you help them form a group?
Well, right now, absolutely. There are groups in place, though. So I would say if somebody's looking to form like a mother's group or whatever, go online and Google Mom's Club or whatever. They actually have a set of bylaws this thick, because I belong to one, and it's thicker than our bylaws at Nami, because I belong to a group in Pennsylvania. And like I said, it's a national organization, but it's a social support group for moms. They have babysitting there so you can meet without your kids, but they don't frown on you when you want to, bring your kid into a meeting. They have all kinds of activities set up. So it's really a social network, which was really something that I was lacking when I relocated to Pennsylvania. As for the work that I'm doing up in Summit County right now, we're just getting started on that. We are just kind of learning the ropes and putting together what it is that we want to do up in Summit County. So it's a coalition. This is the Summit County Maternal Depression Network, and it's a compilation of a bunch of different agencies in Summit County. So it's the hospitals, it's different OBGYN groups, it's social support networks that are all kind of gathering to see what's needed.
One of the things I could go on about this too. We have a grant from the state of Ohio. It's called the Moms Project, to work with opiate addicted women. And one of the things that it is a conglomerate of people working with these women, from medical assisted treatment providers to mental health counseling to addiction counseling to the medical care that we're providing, to nurses that are going into the home and providing assistive care there and making sure they get to their appointments and helping with transportation and reminding them of things. And I think the biggest thing that we're finding in this project that we're doing, of all the things that we're doing, the support that they're getting is the biggest thing that is helping women thrive. And we had one of the women say to one of the home nurses, "Will you be my friend? Because I don't have any friends that don't use, and I can't move from my community." So we started a group called Communities. It was actually one of the nurses from the College of Medicine started the group. It's called Communities, and it's a place where they can meet. They can talk about the challenges that they're facing, talk about their problems, but wonderful people from this community are stepping in and showing those women other things that they can do with their lives. They're learning to crochet, they're learning to knit, they're scrapbooking about their pregnancy and putting their ultrasound pictures in. And I think that support is what we're going to find is the biggest thing coming from this project.
You're here in Athens.
Thank you.
I'm sorry, you're not.
They have you, Tom, they don't need me.
3 announcements. First, there are 2 sign-up sheets over there for CEUs. One is for social workers, counselors, nurses, and a variety of nurses and that sort of thing. The other is for Athens, Nami, the National Alliance on Mental Illness, the local chapter of Nami, and the Friends of the Library.